get going. My name is Tara Antoni Pillay, and I am the chair of Wellbeing Week in Law this year. And I am very pleased to be here to announce and introduce Dr. Leslie Hammer. Before I go ahead and do that, I'm just going to make a couple of quick announcements. First, for those of you who are interested in receiving CLE credit for this program, just remember that there is a form and a link. I will drop that in the chat to fill out. You can also find it on our website. There will also be 2 polling questions that are very basic that you need to answer just to show that you attended. And so that we will have a record of that. Linda will be releasing those at the beginning and at the end of the program. We would love for you to ask questions. Please go ahead and put those in the chat for us. You can put them in whenever they come up for you, and then I will feed them to Dr. Hammer at the end of her presentation, just so that we don't interrupt her, but please feel free to do that. And then also, I just want to remind you of our participation challenge. We have some great prizes, so you can go ahead. I will put the link in the chat as well for that. Go ahead and let us know how you participated in Wellbeing Week in Law, and including this. So I'm just looking, we had a quick question in the chat, but I think it's fine. So we are going to go ahead and get started. I'm going to go ahead and introduce Dr. Hammer right now. We are so pleased to have her here with us today. Dr. Hammer is the Associate Director for Applied Research in the Oregon Institute of Occupational Health Sciences and co-director of the Oregon Healthy Workforce Center, Total Worker Health Center of Excellence at Oregon Health and Science University. She is also a professor emerita at Portland State University and a leading international expert on work and family, occupational stress, and workplace mental health. She specializes in the mental and physical health effects of supportive supervision at work and has extensive experience in designing, implementing, and evaluating worksite interventions and evidence-based supervisor training, including the family supportive supervisor behavior training. So we are thrilled to have you here with us, Dr. Hammer. I'm going to go ahead and pin you and mute myself, and I will let you take it away. Thank you.
Super. Thank you so much, Tara. And I'm really happy to be here today. And I'm happy to be talking about the U.S. Surgeon General's Framework for Mental Health and Wellbeing. And as many of you may know, this is Mental Health Awareness Month. So this is just another important effort in reducing the stigma and normalizing the discussion around mental health. So my background is industrial organizational psychology and occupational health psychology. And I have been studying all kinds of workplaces. So across the board, professional, non-professional, all different types of workplaces for over 30 years. And all of the work that I have done has been in the workplace. So my background, I'm an academic, but I do all of my research and all of my practice in workplaces, and have really grown to understand and value the importance of leadership positions and managers, more specifically, and how workplace structures and aspects of the workplace impact people's and individuals' well-being, health and well-being. And so today, what I'm going to share with you is some background on mental health, workplace mental health, and really reflect on the U.S. Surgeon General's Framework for Mental Health that came out in September of 2022, and how you can think about that in terms of your own firms and how you think about well-being and supporting the workforce within the firm that you, an organization that you work within. And this is actually the second time that I'm speaking at the Wellbeing in Law Week. I guess it's the mental health or well-being week that happens in May. I was here 2 years ago, I believe, speaking on more specifically focusing on kind of work-life balance and manager issues. Happy to be back, and let's get started. What I am hoping that if you have questions, you can put them in the chat. I will try to leave as much time as possible. I have a lot of information to share with you. So I also invite you to reach out and be in touch with me with any follow-up questions that you have. And I see there is a poll going on right now. So I will wait. Should I wait, Tara, for the poll?
I don't think you need to wait. People can just do it as long as it's not distracting to you.
Okay, so it's in the middle of my screen. Is it in the middle of others? Oh, I can reduce it. There we go. I'm back.
Okay.
And okay, super. So let's go ahead and let's talk about mental health. And let's start with really talking about what is mental health. And according to the World Health Organization, mental health is really a state of well-being. It's the ability to perform well, and we can talk about our mental health in a positive way. Mental health really is not just the absence of illness and disease, but it's a positive feeling. And the reality is, however, is that we are not always in a state of positive mental health. And what we see is that mental health problems or challenges do occur and do frequently occur among many, many people. And mental health problems or challenges have to do with really the experience of kind of more generalized anxiety, depression. They may be something that people are experiencing as a result of job stress, for example. And if not recognized, mental health problems or challenges can become severe. And that's when we need to consider mental illness. And mental illness typically requires professional intervention or treatment. And that's when it really has to do with diagnosable diseases that are categorized within the clinical DSM categorizations. And so we need to be paying attention when we experience mental illness or we see mental illness, because it's important for intervention to happen. So what does poor mental health mean, or mental health challenges? Who does it affect? And for some, these numbers may be really surprising. And I think it's important to take hold of this and really think about the fact that this is common, and that we know that 1 in 5 individuals in the US and actually really across the globe experience a significant mental health problem or illness each year. And 1 in 3 individuals will be diagnosed with a mental illness at some point in their lifetime. And 1 in 5 have indicated that the pandemic has significantly worsened their mental health. So what does this mean for all of us? This means that we are either experiencing mental health challenges, somebody in our family is experiencing a mental health challenge or illness, and people around us in our workplace, in our community, are experiencing mental health challenges or illnesses. And that this is something, as I started by saying, that needs to be more normalized. And we are really working on reducing the stigma associated with mental health and mental illness, because this is really impacting everybody. And what has been fascinating to me is that organizations and workplaces, while I have been studying these issues of the workplace and how it impacts mental illness and mental health for over 30 years. Organizations and workplaces are just now really starting to pay attention. And it was brought on by COVID, but COVID didn't cause mental health challenges. It may have increased them slightly, but it brought on more awareness, and especially in workplaces where there was awareness that people were leaving jobs, people were not able to come to work as easily, and people were experiencing mental health challenges that were finally being recognized by the workplace. So poor mental health has been around. It's not anything new. It's been around for a very long time. And we have been studying ways that the workplace impacts our mental health. And it's not until recently that workplaces are really starting to pay attention and do things about the mental health of the population within their organization. So what is our current landscape? What is our current landscape in terms of mental health? So the nation's current landscape is that 76% of workers reported at least one symptom of a mental health condition. And these are based on reports from 2021 and 2022. 84% of respondents said that their workplace conditions had contributed to at least one mental health challenge. And 81% of workers reported that they will be looking for workplaces that support mental health in the future. So this is becoming our reality, that we are needing to pay attention, in workplaces that want to recruit and retain people are going to have to recognize that this has to be part of the culture and the culture of support. So mental health problems really are management problems. And 65% of supervisors in workplaces say that they could do their job more effectively if they had employee mental health training. And 80% of supervisors believe that it is actually part of their job to intervene if an employee shows signs of mental health challenges. Now, it's interesting because the availability of training and support in workplaces around mental health is very limited. And what is out there, there's not a lot of evidence-based trainings and interventions. And what the U.S. Surgeon General's framework has done, and I will get into that in a minute in more of the specifics, is it's really developed a guideline for thinking about and implementing programs and policies within workplaces that are supportive of mental health of employees. So even though supervisors say this is something that they should be doing and they need to learn more about, only 30% of supervisors have received training related to employee mental health. Furthermore, we know that a mentally unhealthy workforce is costly. So according to the National Safety Council, employers spend approximately $15,000 annually per employee who is experiencing mental distress. And this includes an average of 4,700 in lost days and $5,700 in turnover per employee each year. And these are data based on the National Safety Council. So what I have been doing, and as I mentioned, I have been doing research in workplaces for 30 years. I've been doing research on understanding how the workplace contributes to psychological health and well-being of workers, because I am passionate about improving health and well-being of workers and their family members. And the workplace is somewhere that we spend so much of our time. And so what I can share with you is that really the workplace, I think, is the missing link in population mental health. It's not the only point of intervention, but when a time when we see there is quite a lack of behavioral health providers and mental health support systems that are able to really be responding to the needs of our population. And when families are stretched to the brink in terms of supporting mental health, we really do need to recognize that the workplace has a role, that the workplace does have a role in both affecting and being affected by mental health of employees. And research suggests that the workplace managers and supervisors are absolutely critical to bolstering the social connection and belongingness, and also in designing work so that demands are reduced or that they're evened out, not having as an extreme effect on employees. And it's important to look at the workplace because, as I said, most adults, spend an enormous amount of their time, their waking time, at work or doing work. And now when I say at work, I don't mean physically at work, but it is engaging in our workplace activities. And so the workplace and both the kind of the conditions and the physical conditions, as well as the social conditions, can impact our mental health. And just as we can think about physical hazards in workplaces such as construction, such as firefighting, such as police work, we can think of also the psychosocial hazards of more knowledge work, work related to more professional work, law, for example. And psychosocial stressors are those stressors that have to do with interpersonal challenges, those stressors that have to do with demands of work, those stressors that have to do with the way that management and leadership treats employees and the way that employees treat each other. These are examples of the psychosocial hazards of the workplace that can impact workers. And what we talk about are that psychosocial hazards are just as important as physical hazards in impacting both physical health and mental health of employees. So most of our efforts that are focused on improving mental health have really focused on social connections. And these social connections are critical. Social connections within the family, social connections also within our work domain, but those are stretched thin. And so work has been discussed as a social determinant of health, and it can affect physical and health and psychological health positively and negatively. So what are some of those key work stressors or those psychosocial stressors that I mentioned? And these are all risk factors for mental health challenges. And these are factors that can be impacted by people at work and leadership and management. And let me just mention some of these. Low employee control over work. And I'll come back around to this when we go more specifically and dive into the Surgeon General's framework, but low employee control at work creates enormous amounts of stress for people, just as low pay does. Low social support, especially from supervisors. There's a long history, decades and decades of research showing that social support from supervisors around work-family support, around support for health, both physical and mental health, impacts how people are doing at work. And it relates to the stress that we're experiencing. How people are treated in terms of fairness. Sometimes people don't feel fairly treated at work. That creates an enormous amount of stress. Just as high job demands. And I think we all know what that feels like. And we also know that there may be ways of adjusting those demands to lessen the amount of stress that people are experiencing. And this is important because workplace stressors have a significant impact on us at home and at work and they also have this significant impact on our physical and our psychological health. So these workplace stressors can impact our family life, our marital stress, our work life stress. We can bring these stressors home, cross over into the family, and they can also impact our work performance, how much burnout we experience, our commitment at work, absenteeism, and turnover. So it is important for workplaces to understand how to reduce those stressors, not only for our physical health and our psychological health, also because of the work outcomes and the non-work outcomes that are associated with such workplace stressors. And just to be clear, we do know, and there are lots of data that are showing that the stress at work is directly related to things like cardiovascular disease, diabetes, substance abuse, as well as mental health. So how do we reduce these occupational stressors and these hazards that I refer to? These hazards, the critical hazards are high demands. So reducing those high demands, increasing worker control, increasing pay, and increasing social support at work. And social support at work is one of the key factors that I have a fair amount of evidence showing that when we actually train managers and supervisors on how to be more supportive at work, be supportive around work-life support, physical health, mental health, their employees and team members actually report improved physical health and mental health 6, 12, 18 months down the road. And we even see improvements in employees' families and in terms of objective physical outcomes like amount of sleep. And so these findings are actually based on randomized controlled trials, so very rigorous research studies. So let's move on and now talk more specifically about how these psychosocial stressors are now tied in with the Surgeon General's framework. And a little over a year and a half ago, I was invited to participate in a research roundtable that was the development of the collection of information that the Surgeon General was obtaining in the development of his framework. And so the framework really drew on input from people that were in jobs, lay people, professional people, academics, and researchers. And so I was invited to provide my expertise and my focus on workplace psychosocial stressors and mental health, and really specifically the role of supportive supervision. And that led into and fed into the Surgeon General's framework. And it was a wonderful meeting, I have to say, because there were just 6 of us that provided that critical information in terms of the research perspectives. And so what we now recognize is the Office of Surgeon General has stressed the importance of the manager role in promoting positive mental health at work through the workplace mental health framework. And that manager role and leadership are important and have direct connections to the health and well-being of people at work. Now, I'm not sure if those of you on the webinar have already taken a look, but if not, I'll be providing a link at the end, and it's very useful to go directly to the framework, the guidelines that were developed by the Surgeon General. And these guidelines are together in a booklet that is it's about 30 pages. So this is not unruly. This is something that's easy to work through. And there are links within the framework to resources. And the framework is also available online. And so the Surgeon General recognized and stated that the pandemic has presented us with an opportunity to rethink how we work. And we have the power to make workplace as engines for mental health and well-being. And doing so will require organizations to rethink how they protect workers from harm, foster a sense of connection among workers, show them that they matter, make space for their lives outside of work, and support their long-term professional growth. And as I mentioned, this framework was put out in September, October of 2022. Around the same time, the World Health Organization put out guidelines for workplace mental health, which are a little bit more specific in terms of direction and what workplaces can do. And I suggest actually that you take a look at both the World Health Organization guidelines, which I also have a link to at the end here, as well as the Surgeon General's framework. And the Surgeon General also has several other frameworks several other reports that I want to mention. And one was a specific report that came out in May of 2022 that was focused on really the health and well-being of healthcare workers specifically. Okay, what we're talking about today is more of a general framework. And the Surgeon General also came out with a report on adolescent mental health. And then just today, a report on the importance of social connection and belongingness to psychological health and well-being. And that report is almost embedded in everything that I do. And the report came after what I've been doing. So I have been focusing on social connections and belongingness. And that's the core of where my recommendations come in around changing workplaces. So the framework, the Surgeon General's framework consists of 5 essential elements. And these are essentials for workplace mental health and well-being. And these essentials are focused on workers' voice and equity. And each of these 5 essentials is grounded in 2 different human needs. So let's dig in to each of these. First of all, protection from harm. Now, the key human needs that are associated with this first essential, protection of harm, are safety and security. Utmost importance is that people feel safe and secure at work. They must feel safe and secure at work, and that means safe from physical harm, and it also means safe from psychological harm. And that means safe from bullying, safe from harassment. Safety is critical, just as security, and feeling that they have some sense of financial security and job security. And there are 4 key components of this first essential aspect of protection from harm. So first of all, the component of prioritizing workplace physical and psychological safety. And that means that people really will not be able to perform their jobs well or effectively if they do not feel safe. And so making sure that this is a priority in the workplace. And that means that in law, for example, we want to make sure that the work environment is free from harassment, free from bullying, and free from those psychosocial stressors that I have mentioned. So we want to pay attention to the amount of control that people have over making decisions at work. We want to pay attention to the demands that people have. And we want to focus on really ensuring physical and psychological safety. And the next key element is this key component of this essential element is enabling adequate rest. So I know that in law, many people do not necessarily get the appropriate amount of rest. And what is that appropriate amount? Okay, we know from doctors, research, evidence that the appropriate amount of rest that everybody pretty much needs between 7 and 9 hours of sleep a night. That is what we need. And are we getting that? No. People are not getting that, and people are suffering. And so people are more likely to experience stress and anxiety and possibly depression, other mental health outcomes when they are lacking sleep. Long hours, long work hours really are the demands that I mentioned that pull on our sleep. And then the next item is also the next component is normalizing and supporting mental health. And that has to do with really reducing stigma and having resources available and talking about those resources, such as employee assistance programs, such as access to health benefits, making sure that employees are aware of those benefits and resources, and talking about them and making it more easy and accessible to talk about mental health at work. And then the last component of this first essential area is operationalizing diversity, equity, inclusion, and accessibility norms, policies, and programs. And this really has to do with promoting and including and supporting diversity at work, promoting the feeling of being authentic at work, celebrating diversity at work, and making sure that work is free from prejudice, bias. So let's go on to the second essential component of the framework, which is connection and community. And as I said, the Surgeon General just came out today with a framework focused on social connection and belongingness. And that is because we know that social connection is directly tied to our mortality. Social connection is more closely tied to our mortality than things like smoking, diabetes, cardiovascular disease. Yes, if you can believe that, it is true. There is a lot of evidence demonstrating, and there are meta-analyses that have been conducted showing that social isolation and social belongingness and connectedness are such a basic need for us that if people do not have that need filled, they suffer, and they suffer extensively. And this has been shown, and we are now recognizing and promoting the critical importance of support and connection at work. So the key components here are to create cultures at work of inclusion and belongingness, to create cultures that support workers and help them to feel that they are part of a greater organization, to cultivate trusted relationships. And those trusted relationships that are cultivated can very much impact our mental health. Those relationships with supervisors, those relationships with managers, those relationships with coworkers. And fostering that collaboration and teamwork. People working together and people having a positive work environment to interact. Now, a lot of this is related to the concept of psychological safety and making sure and supporting psychological safety at work is tied to our effectiveness and our health and well-being. Psychological safety is a belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. And it's the feeling that the team is safe for interpersonal risk-taking. And this was promoted by Amy Edmondson and has been shown over and over again to be a real basic piece of the connection and belongingness that people feel at work. And it's also closely tied to supervisor support. And some ways of really developing and promoting psychological safety for managers and employees are really getting to know each other, making sure that we're checking in with each other. When somebody shares with you that they have perhaps a challenge with a family member, or they may have a mental health challenge that they are sharing with you, make sure that you go back, you check with them. You check in a week later, a couple days later, you listen and spend time learning about each other and learning about people at work and learning about your employees at work. Trust develops. And that's how we also can learn more about proactive and responsive supportive behaviors, which I will talk about shortly. So the next essential is work-life harmony. And this is the third essential part of the Surgeon General's framework. And this essential has the critical needs of autonomy and flexibility. And luckily for jobs, many of the jobs that you're dealing with and that you are involved with within the law profession do have a fair amount of autonomy and flexibility. But you can imagine that there are some jobs that do not. And that's why this is a key essential element. And the components of this include making sure that we're providing more autonomy over how work is done, where it's done, when it is done, but providing autonomy and control in how, where, and when people do their jobs. Now, this is a very interesting issue because it's not that we can provide all of those aspects. There are some jobs that cannot have autonomy in terms of, or control, people can't have control in terms of where they work. And we need to understand that. And we need to then provide autonomy and control over other aspects of work. So the autonomy and control can be provided in different ways based on the types of jobs. We also know that it is important to make sure that work is as flexible and that the schedules are actually as flexible and as predictable as possible. When I say predictable, this has more to do with hourly workforces that sometimes in retail, for example, in restaurant business, they do not get schedules very far in advance. And it makes it very difficult for people to manage their, for example, non-work responsibilities. And so having schedules in advance, way in advance, is helpful to one's work-life harmony, which ultimately improves mental health. Similarly, increases in access to paid leave. Now, in the US, we are the only industrialized country where we do not have a nationally mandated paid leave law policy. And as you're probably aware, we are really at the bottom of the barrel when it comes to industrialized nations. Now, there are workplaces, and about 79% of workplaces do provide some type of paid leave. Okay, that's good. That's good, even though we do not have a national policy. However, what we know is that of that 79%, about 35% of low-wage workers, only about 35% of low-wage workers actually had access to paid leave, whereas about 95% of more professional and higher paid workers did. So paid leave is still an issue, and it's especially an issue in lower wage jobs. Similarly, and when we talk about paid leave, we're talking about both sick leave and parental leave. So there are jobs that people don't even get compensated when they have to miss work because they're sick. And that's still happening in this country. So the fourth essential piece of the framework is mattering at work. Mattering at work is related to the needs of dignity and meaning. And that's that we can connect to work and we feel good about what we're doing. So the components involve making sure that people are provided a living wage, engaging workers in decisions, and building a culture of gratitude and recognition. When people are doing well, when people are working hard, it's important to recognize their efforts. And also having people connect to the overall mission of the work of the organization, the overall goals. That helps people to feel more committed and connected to each other and to the ultimate goals of what everybody is trying to accomplish. And finally, the fifth essential element that's associated with the framework is an opportunity for growth. And this has to do with the needs and filling the needs of learning and accomplishment. Opportunities for growth, sometimes we don't think about this, and we do need to think about this. We need to think about career paths for people and offer training and education and identifying opportunities for promotion, ensuring feedback so that people can learn and perform and improve their performance, leading to more opportunities for moving up and getting promoted and doing more at work. So these are, again, the elements that are put forth that supervisors and managers could think about integrating into the workplace. HR representatives, well-being directors, think about how we can kind of springboard off of this framework and integrate with this idea of supervisors being part of this missing link and the workplace being part of this missing link. And so what I'm going to spend the last few minutes talking about before I open it up for Q&A is training that I have developed along with my colleague, Dr. Jennifer Dimoff. And again, as I shared, I've spent my 30-year career focusing on ways that we can improve health and well-being of workers and employees. And the key way that I have identified in doing this is to train managers and supervisors on how to provide support, because there was a lot of correlational research saying that manager support is important to employee well-being and engagement. But yet there was nothing that was really prescriptive telling supervisors and managers and leaders what they should do. So I have worked with colleagues and most recently with Dr. Dimoff to identify these proactive and responsive support strategies for improving mental health of employees. And so these are strategies that are taught to supervisors and managers and leaders on ways of improving employee mental health. And we have already evaluated their effectiveness we started actually with a grant from the military and evaluated this training in among active duty military service members. So training junior platoon leaders and evaluating the effectiveness in their soldiers. And then we've extended it now to non-military, where we have evaluated the training in at my university, at Oregon Health and Science University, with all different types of positions and jobs, not just academic. So it's a medical university. So we have docs, we have all kinds of clinical workers, and we also have all kinds of researchers and students and faculty, teaching faculty. We've also evaluated its effectiveness in several other university settings, as well as a large-scale health organization. And so time and time again, what we are showing is that when we train supervisors on these strategies, we see improvements in psychological health and well-being of employees. And most of these studies have been based on randomized controlled trials. So I'm going to quickly just touch on each of the proactive supportive behaviors and the responsive supportive behaviors to give you a taste. So being proactive has to do with teaching managers how to really reduce stressors through reducing demands, increasing control, increasing pay. And here we focus on increasing social support at work. And that social support can be emotional, practical, role modeling, and reducing stigma. So emotional support has to do with what you do to help your workers feel heard, help your employees feel heard, to show them that you understand about their family, their personal lives, that you care about them as a whole person. And that has to do with interacting with people and learning about your employees and your coworkers. Practical support involves supervisors and managers making some practical arrangements for workers so they can meet ongoing demands, so they can meet unexpected family demands. It may be finding areas to cross-train people or to really fill in when somebody has to take off for a family emergency, for example. Also clarifying the types of resources, as we've talked about, types of resources such as employee assistance programs, resources in the community related to mental health. Role modeling has to do with the idea that managers and supervisors should be walking the walk. They should be actually showing that they are taking care of themselves and their own mental health so that their employees can understand ways of taking care of their mental health. And this is important because people learn vicariously. They learn from others. And so when people see you take care of your mental health, and whether it is for your employees or your coworkers, they learn to do the same. And then reducing stigma. And this really has to do with the idea that it's okay to seek help and normalizing. Right now with the basketball playoffs, they're starting, and with Mental Health Awareness Month, they're talking about, the players are talking about their mental health challenges. The more we talk about it, the more we normalize, the more we show that everyday people experience mental health challenges, the more it becomes easier for us to also seek help. And then finally, it's important for managers and supervisors, as well as coworkers, to be responsive, to know how to be aware and identify if there's somebody having a mental health challenge, how to identify the warning signs, and how to refer people. Now, a big point of clarification here is that nobody, and I'm same with me, I am not a clinical psychologist. I'm an industrial organizational psychologist, and no manager or supervisor should be diagnosing anybody. What managers and supervisors and employees and what we as people want to do is we want to identify when somebody is struggling. And if we identify when somebody is struggling, we can then suggest resources and options for them. So the first aspect is being aware and recognizing when there is a warning sign. And those warning signs can actually come in the form of maybe performance problems, attendance problems. We see extreme warning signs that can be when people might start neglecting their own personal hygiene. Social withdrawal is another warning sign, and distress. And these signs of struggle are important to know. And what we want to do is we want to actually think about them when if an individual deviates from their kind of typical normal behavior. That is when we see a sign of struggle. And then we take action by suggesting resources. And I hope everybody, if you are not aware, you should be aware of the National Suicide and Mental Health Crisis Line, 988, just like 911. 988 was implemented July 15th, 2022. It's a line, a crisis line to call if you or a loved one or a coworker, colleague is in a mental health crisis. There are people at the other end. They respond. The response times have been 1 to 2 minutes, 24 hours a day in multiple languages. And as I said, there are additional resources. And what you can do is you can also, you can obtain the resources online, the Surgeon General's priorities. And as I said, in the Surgeon General's booklet, basically on this framework, there are a lot of resources that you can link to. And I have my own evidence-based resources available through my Center for Supportive Leadership. And that's at supportiveleadership.org. And then I am going to now, I know I don't have a lot of time, but I want to turn it over and open it up for questions. So I think what I'm going to do is stop sharing, if that makes sense.
Perfect. Okay, so let me just, I'm going to keep your spotlight on, and then I'm just going to go ahead and go through the questions. One of the main questions folks had was about the slides and the links. So if there's any way of sharing a portion of those, or
I am happy to share so this will be on a recording, but yeah, the slides I went through quickly. I will share PDF versions of the slides. They are copyrighted, but people can absolutely use their slides as resources, and the links will be in the slides. Yes, because again, I want to make sure that I'm providing as much support here as possible.
Yeah, that's great. That's really helpful. Okay, so this is the first question. Sorry, they're coming in a little bit fast and moving around. The first question is, as attorneys, we don't necessarily have a manager. Associates, they report to kind of whoever they are working with on a particular project. So how do we teach partners and other supervising attorneys to create a psychologically safe workspace when the system might be a little different?
Yeah, the system is very different, and it's really developing that culture and having trainings that are for everybody. So whether it's managers or supervisors or coworkers or the system within law firms, it's providing people the information and trainings on how to improve psychological safety, and the information that engagement and developing those social relationships help to improve that psychological safety. It's a very quick answer to a very complicated question.
Yeah, no, that's very helpful. Okay, here's another sort of complicated, but very good question. Do you believe that organizations and law firms, do you believe that they currently feel a responsibility to ensure mental health? And in your experience, what helps bring organizations to that mindset?
Great question. And I think it comes with time. And that's why I've been so pleased to see in the broader population that we are showing movement. But I think what happens is when you see the Surgeon General coming out with a framework, when you see the World Health Organization coming out with a framework, when you see countries coming out with standards, and our country is moving in that direction. Canada has for example, they have a mental health standard. There are other European countries that have similar standards, but it's really the sharing, I guess, the information from the leaders of our country and from the leaders of the workplace and the culture. So we can change the workplace culture, and it has to come from the top.
Yep, that's a great question. Okay, and a great answer. Here's another question. How do we handle employee perceptions of psychological safety or safety at work, particularly when someone has a mental health condition? So particularly if this person is asking a sense that they don't feel safe, right? Or when you're trying, but there's still not a feeling of safety.
And that may be beyond an individual's ability. So we can't, as I said, we are not, we can't be therapists, and we can only do so much. And so, and developing relationships and communications and making it welcome for people to share their concerns is what we can do. We are not going to be able to cure people, and there are at times people are going to need professional help, and what we can do is refer them and provide them with resources.
That is very helpful. Thank you. So I have one last question here that we can squeeze in. Do you suggest for people who are attorneys kind of managing themselves, do you suggest that we schedule a mental health day, considering we don't really have paid time off?
If that's absolutely, I mean, if that is possible, that will be wonders. I mean, people need to have breaks. People need to almost be told sometimes that it's time to take care of yourself. And scheduling a mental health day may be the way that we can do that.
Yep. Okay, that's great. Thank you. There's a lot of other questions in here.
I know.
Most of them by saying, I think a lot of people are interested in where they might go to get training or how they might suggest training in this area. So perhaps we could follow this up with some resources.
Here, I'll put here, this is supportiveleadership.com. And I should have probably put that up, but I'm not trying to promote my own stuff. So I want to be careful of that. So that's a website, supportiveleadership.com. And I have a number of my trainings available, and the workplace mental health training is now information on that is available there.
Great. That is wonderful. And since we cannot give Dr. Hammer a round of applause, if everyone could just put your thanks and your comments and your notes of appreciation about what you enjoyed about this in the webinar chat so she can see them, that would be great. There they go. Boom, boom, boom. So nice. Thank you everyone for attending. This was really wonderful and informative. Don't forget the